Hi everyone, myself Saranya, Assistant Professor from SNS College of Allied Health Sciences, Coimbatore. Today's topic is on acid-base disorder. In previously we have discussed what is acid-base balance. Kindly refer to the previous video. Case study. A 50-year-old patient has a complaint of severe diarrhea for the past 2 days. The patient was admitted in an ER, was noticed with weakness, dizziness and fainting. The patient was undertaken for an ABG analysis. The report shows that pH will be 7.50 and partial pressure of carbon dioxide 55 mmHg, partial pressure of oxygen 300 mmHg and the bicarbonate level is 35 milliequivalents per liter. Interpret the condition and management modalities for the patient. Before going for the condition, let us see what are the acid-base balance disorders available. So, the first one is respiratory acidosis. In case of respiratory acidosis, normally the pH will be lower, the partial pressure of carbon dioxide will be high and the bicarbonate level is high. What are the causes for this disorder is, it depends upon the respiration, that is called as lungs disorders, as well as using of narcotics, drugs that leads to CNS depression and respiratory center affection. So once this happens, the patient will have an hypoventilation, that is the patient is not ventilating properly, that leads to buildup of high amount of carbon dioxide inside the body. However, the kidney tries to help up with the production of bicarbonate to increase the pH. What symptoms that patient will be having is hypoventilation that leads to hypoxia, drowsiness, dizziness and disorientation, muscle weakness and the BP will be dropped. Headache, hyperkalemia and dysarrhythmias will be seen. So what management that you can give for this patient is, the patient has a hypoventilation. The word itself says hypo is low. Then make the ventilation normal for the patient by giving an oxygen supply to the patient through any mode, either a non-invasive ventilation or through intubated invasive ventilation. Next one is respiratory alkalosis. In case of respiratory alkalosis, the pH is high but the partial pressure of carbon dioxide is low. It is in opposite direction. And the bicarbonate level will be slightly normal or maintaining in a normal range. So what causes this respiratory alkalosis is hyperventilation and excessive loss of carbon dioxide from the body. However, to compensate this, kidney will be acting to reduce the pH level and bring back the pH level. What symptoms the patient will experience is seizures, deep rapid breathing, hyperventilation, tachycardia, hypokalemia, numbness and tingling of extremities, nausea, vomiting, lightheadedness, lethargy and confusion. What treatment that we can give is, you want to first suppress the patient condition and vitals to a normal, and then you can give an hyperventilation with the help of, you can correct it through paper bag. It looks silly, but paper bag is a thing that you can breathing inside a bag. The carbon dioxide what you are giving out will be again inhaled by you to the inside of your body, so that the carbon dioxide wastage will not be done. This is a simple way of correction. Next one is metabolic acidosis, that is an acid buildup in the body. So here the pH is low, partial pressure of carbon dioxide is low and bicarbonate level is also low. So this type of reactions occurs in case of diabetes mellitus, shock, diarrhea, renal failure, liver disease and sepsis. However, in case of metabolic, the lungs try to help us to blow off the carbon dioxide to rise up the pH. The patient will experience an hyperkalemia, muscle twitching, headache, decreased BP, nausea, vomiting, diarrhea, warm, flushed skin, and Kushmal respirations, and loss of consciousness. The treatment modalities that we can support for this acidosis is to add the base, that is use of bicarbonate solution or a sodium bicarbonate injection to the patient. Finally, it is metabolic alkalosis. Here which the pH and the bicarbonate goes in the same direction. The bicarbonate level is high, it is more than 30 milliequivalents per liter. The pH is high, the partial pressure of carbon dioxide is high. The urine pH is normal as 6. Here the pH exceeds the acidic phase. The serum potassium level is also low. Why this condition happens is the patient has a dehydration or prolonged vomiting, nasogastric suction, or the ingestion of NaHCO3, that is high toxic level of sodium bicarbonate ingestion, and diuretic therapy without potassium. However, lungs try to help us with retaining of carbon dioxide. So the modalities of treatment varies, that is you want to correct the true volume depletion, that is you want to support the patient energy so you can give some fluids, and correct the potassium depletion by administration of sodium chloride, and correct the chloride depletion also by administration of fluids. If the patient is a kidney failure patient or if having an edematous, then you want to add acetazolamide together. So finally, what is the summary is, we have seen the case study. In that case study, the pH has been increased and partial pressure of carbon dioxide has been also increased, and the bicarbonate level is being maintained. So what could be an answer for this? Let us see as in comment. Definition, what is acid-base balance we have seen. Ideate, the ABG disturbances, its interpretation, and in evolve we have seen what is the treatment modalities that we can support. Thank you.